Hi, I'm Dr. Franck Yata. Thank you for joining us for the 6th episode of our series. Of course, if it's the first time, please start back with episode 1. Today, we'll be talking about diagnosis and treatment. First, let's quickly talk about diagnosis. As we've said several times, diagnosis is primarily a decision made by the medical specialist. This is extremely important to remember. Even if ED signs are obvious and clearly observable, it is only after a series of physical, laboratory, and even imaging examinations that the doctor will conclude that erectile dysfunction is present. Don't be convinced of a dysfunction that you do not actually have, because then it will only worsen your situation considering the psychological stress that it will bring. Remember that there are forms of erectile dysfunction that are temporary, or easily curable, or simply pseudoerectile dysfunction. In conclusion, take the courage to see a specialist for a diagnosis. So don't draw conclusions yourself. Now, let's talk about treatment. To start off, I would like to remind you that the purpose of this program is not to show you how to self-treat yourself from home, but rather to give you the broad outlines of the treatment principle for your information. The general treatment principle will have 4 pillars. The first is adjusting your lifestyle and taking certain oral medications. You will have to quit smoking, cut down on alcohol consumption, exercise regularly, lose weight if overweight, manage your stress and anxiety, and of course, get enough sleep. Taking medications that inhibit the enzyme PDE5 or phosphodiesterase type 5 can help to temporarily resolve the inability to achieve a satisfactory erection. But the problem is that you cannot take these medications continuously due to the side effects and serious risks they pose. Among these medications, you have, of course, sildenafil, the most popular of which is Viagra, tadalafil, including Cialis, vardenafil, including Levitra, and Avanafil, including Stendra. Their continuous use is therefore highly discouraged. In general, Viagra and its analogs do not exhibit physical addictive effects, but some people may become dependent on Viagra to achieve erections or to increase their confidence during intercourse, leading to psychological dependence. Not physical dependence, but psychological. In fact, they think they need it to have a good erection, but actually, they don't. When is the best time to take these meds? Sometime before intercourse. For example, for Viagra, approximately 1 hour before, while for Cialis, it's about 30 minutes before. And always take small doses. Contraindications. Remember that they increase blood flow by enhancing the effects of nitric oxide, which in turn induces vasodilation. This vasodilatation in the long term or at high doses can lead to dangerous hypotension. That dangerous hypotension will more or less immediately be responsible for a slow heart rate, dizziness, vertigo, fainting, or even cardiac arrest. In some cases, this severe hypotension can lead to a reactive hypertension and a dangerous acceleration of the heart rate, which can also lead to cardiac arrest. So, we never encourage the continued use of Viagra or similar drugs. Dr. Yata prefers other methods that yield much better results by focusing on physical and natural practices, including indigenous ones. If oral medications do not solve the problem, the second pillar of treatment will be based on physical, instrumental, and non-oral drug techniques. 1. Let's talk about vacuum erection devices or VEDs. These are clear plastic cylinders with an opening at one end that are placed over the penis. A pump is attached to the cylinder that draws air in to create a vacuum. The pump can be hand-operated or battery-powered. The vacuum reduces the air pressure in the cylinder and increases blood flow to the penis. A constriction ring will then maintain the erection. The DEV is non-invasive and safe in most cases. 2. Let's talk about penile injections. These involve injecting certain products directly into the penile tissue before intercourse. The action is generally rapid and effective in 80% of cases. 3. We can also talk about intraurethral suppositories, which are products introduced into the urethra at the tip of the penis using an applicator. Medications applied 15 minutes before intercourse can dissolve inside the penis, relax the smooth muscle, and facilitate the blood flow that causes an erection. They are less effective than injections. 4. In cases of premature ejaculation, some doctors recommend anesthetic ointments to reduce local sensitivity and thus reduce the psychological pressure that can trigger the ejaculatory process. 5. Also, in the case of premature ejaculation, mental defocusing or deconcentration techniques are recommended to reduce psychological pressure.